to overdose deaths, and just raised that we are currently in what is known as sort of wave 4 of the overdose crisis, with wave 1 being the original prescription drug crisis, wave 2 starting when heroin started to replace prescription drugs as prescriptions for opioids went down, phase 3 when heroin started being replaced with synthetic opioids like fentanyl and fentanyl-related substances, and now wave 4, where we are seeing a sort of mixture of fentanyl and fentanyl-related substances with stimulants, both intentionally and unintentionally in the drug supply. So we're seeing a lot more stimulant users overdose from combinations of stimulants and fentanyl, or just fentanyl they thought was a stimulant. And that's kind of that steady uptick that we get from around 25 to 30,000 deaths a year about 15 years ago to the over 109,000 deaths that we are seeing annually now. So sort of with that as brief context, I want to pitch it over to Caitlyn and Shannon to give a little background on themselves and the work that they do. So Caitlyn, let's start with you.
Hey everyone, my name is Caitlyn O'Neill, they, them pronouns. I am one of the co-founders of New Jersey Harm Reduction Coalition, and now I work still with New Jersey Harm Reduction Coalition as our drug user health and liberation strategist. It's a long title, but trying to encompass everything that we do. But what that means is I do a lot of frontline work, and I do a lot of following some of the things that Drew was just talking about, keeping up with the drug supply, keeping up with safety, safer use techniques, and really just helping our folks survive. I am, my exposure to harm reduction came from using a syringe service program before I knew what harm reduction was, that it was called that. And then I've been doing the work. I was professionally for about 4 years now, but up until then, it was just like kind of in the trunk of my car or whatever. And actually up until a couple of weeks ago, it was in the trunk of my car probably, right? But in New Jersey, NJHRC does advocacy work. We work to advance drug policy, to expand harm reduction in New Jersey. We do technical assistance for groups newer to the concept of harm reduction as that expansion happens, so that like we can keep the true spirit of harm reduction. And we do direct services through our partnership with Next Distro in the mail-based area. For all of New Jersey, and locally here in New Brunswick, which is the beautiful city you can see behind me.
Okay, you finished there. One of the best things when we had our run through of this webinar or whatever we did there, found that Caitlyn's the only person I've ever met on Zoom who can interrupt me as much as I interrupt them. So I was like, finally I have a match, because like that's my like biggest fear. It's like, anyway, my name is Shannon Knox, and I'm the executive director or whatever at San Francisco Drug Users Union, which is a 100% drug user run organization. We hire mostly our participants. We have memberships, which is like, well, I guess what some folks would call a steering committee, but they're here every day. They're volunteers, members, family. So really tight knit with the people who use our services. And yeah, I too was brought into this work not knowing that harm reduction was a profession. I was brought in by my friend who was moved into this trailer park down the street, or down the railroad tracks from where I was living, on a caboose. And she got kicked out of Cambodia recently, running a harm reduction program there. And when I got to the back of the Bay Area, she asked me if I would make a comic about this needle exchange San Francisco Drug Users Union, because I'm an artist, and I did. And then I wound up working here, and it's been about 10 years. Well, I went to LA for a while and ran the LA OEND county OEND program, where we had 300 partner sites providing naloxone and doing trainings, built a 5-part training series, blah blah blah. But being with the people and doing direct services is my love, so I get to do that here, and it's exciting.
Awesome. Thank you, Caitlyn and Shannon, for the introductions. And I figured we'd kick it off with a not so simple question. In that sort of, we know that the drug supply is very different depending on where you live in the US. But in your parts of the country, I'm wondering if you each could sort of go over what the current drug supply looks like in your area, and how that's impacting the work you do on the ground and what the needs of the folks you serve are.
I guess I'll start. We'll go east to west. I kind of love that we're like, kind of like a sandwich of like the whole country of like East Coast, West Coast, and hopefully folks in between. So in New Jersey, I would say about over 10 years ago is when like fentanyl started showing up in the drug supply. So we started really losing people rapidly. We are at a point now where everyone I know that uses heroin uses fentanyl. They don't even expect it not to be fentanyl when they're purchasing. And that's also because we've always had powdered dope here. So it was a little bit easier to like get fentanyl going in that supply, I guess, originally. We hear a lot of kind of like fear and panic about fentanyl and the stimulant supply. I don't have too many folks that test, at least our program, that test their stimulants. Although we do have some reports, like folks in the city who are people that use stimulants and report feeling sleepy afterwards. So like, I smoked crack and I felt a little tired is not the normal expectation. So we do know that it's most likely sort of infiltrating. And we're at the point, at least I'm in Middlesex County. So like if you threw a dart at New Jersey to hit the center of the state, that's where New Brunswick is. And so we kind of get some of our supply comes from New York City, some comes like from Philly, some comes just like right into New Jersey. Like we have drugs from all over the place. And so I try to follow like the drug trends of what's coming down, what's coming up, what's coming sideways. We've had xylazine for sure, like test wise for at least a year, but probably a little bit more than a year in New Jersey. Obviously some of the areas like in Camden, that's really close to Philly, they obviously like their supply had xylazine in it a little bit before ours did, a little bit more north in the state. And right now we are seeing in New Brunswick a lot of folks with visible signs of xylazine use and reports of like the feelings of the drugs. And then we also have shout out to the Harm Reduction Center in Asbury Park, Prevention Resource Network, put together a list of close to 40 bags that were tested from all over the state that tested positive for xylazine. And we've probably added about like 6 to that list since we got it from them. So we do know it's here. So that's where we're at right now.
Well, just like with fentanyl, we're like right behind you. You guys got fentanyl first, East Coast got it first, and we started hearing about it coming. Well, at the union, members were getting excited. I think they thought it was pharmaceutical. I think we all did. What's with this fentanyl in the street? It's here all of a sudden. No one really knew it was coming down the line there, and the excitement is not exciting anymore because everyone kind of misses heroin. Heroin is not really around. So, hey, Bill, could you leave that in there? I'm sorry. So I've got Narcan being delivered while this is going on. So we have 2 different types of fentanyl, at least in San Francisco, that people buy. There's regular, they call it, and there's isofentanyl is the other one they call it, which is an analog that was developed in 1973-ish or something. Whether or not it's actually, I think it's an isomer analog, it's a category. The ISO is really strong. The regulars, it's like quantity or quality. The quality is the ISO, the quantity is the regular. And what I see is when we have people overdose, of which we've had 2 in the last 2 weeks, like at our site with our old members, people overdose often when they're, using someone else's drugs or something, or they're not getting from their normal supplier and they're getting ISO instead of regular because it's so much stronger that a little amount can, a little dab will do you. We don't have xylazine so much yet. We've seen, I think the last I checked, there was like 15 positives of all the tests that have been done in San Francisco, which, I don't know how many there have been done. It's like 1 or 2%. But we do have xylazine test strips on site here, but I try to encourage people if they're going to test their fentanyl, like if they're suspect, to test their stuff here. So that we can get any information on whether or not they get a positive. And then, yeah, we got speed. We got crack still. We got crack. People get Brillo all the time. So we still got that stuff going on. That's exciting. A little old school with the crack. kind of like, we missed the old school a little bit. And heroin's hard to find, but there is some out here, but it's all got fentanyl in it.
You just had a Brill Cream reference, so I think you do indeed like the old school. Um, just want to, I guess, sort of with the fentanyl test strip piece, if, and I guess this might apply more to New Jersey than California, but it could be so ubiquitous now on the West Coast that it's the same both places. How do you effectively use fentanyl test strips when it's so ingrained in the majority of the supply? Is it still useful to use them? And if so, like how do you find utility doing that?
So I don't want to sound like, like Debbie Downer, but I think in New Jersey for heroin users, opioid users, fentanyl test strips are a little redundant. Most people know to expect that, but they're still helpful as a conversation starter for folks like that. If they're, somebody's client or something like that, and they're trying to open the door of like, hey, I kind of know that you might be using, like, they are a sign of like, I care about you and want you to stay alive. But we find them really useful on the East Coast here. I think their most use right now is like in a nightlife setting or in a setting for people who are like, weekend warriors or like newbies to trying drugs. So like college campuses, things like that. We're really adamant. We've had parents reach out and ask for test strips to test their children, and that's not what they're for. The test strips are for drug users to test the drugs before they use them to see what's in them. And we fought really hard to decriminalize fentanyl test strips in New Jersey, and that happened recently. So it is kind of they're popular, but they are more so they're like important, but they're not like a fentanyl. I always say to people, a fentanyl test strip isn't going to save your life. Having naloxone and having someone around and having naloxone on the table, that's going to save your life. A fentanyl test strip is more informative. Because if I just like spent my last $5, I'm not going to throw it out just because it tests positive. And so the reality of that is it's more like, now I can know, maybe I want to like text Shannon and let her know to give me a call in an hour and make sure I'm like still here. But that's what I see them
In an
as.
hour.
Yeah, maybe not an hour.
1 hour from now, I'm going to check it on you.
I'm going to really meticulously set this shot up. No.
It takes me that long to hit,
Sorry.
like
But yeah, and so we're just starting to get xylazine test strips. They're not really decriminalized yet in New Jersey, but I don't care much about that. We've got them. We've got folks using them locally, and they have been popular because we're just starting to see xylazine. It's not necessarily in everything. So now's the time to like really get on board with xylazine test strips, at least here in New Jersey.
Yeah, I would say that like for fentanyl test strips, I actually just had this experience, like I think it was this morning, where I saw some white powder somewhere in the world, and I was like, I wonder what it is, and because I don't know, whatever, the type of person that would wonder. And I didn't test it, but it still exists somewhere in my life. I'm like, I should test that. I know it, but the thing is, it's wishful thinking, I think, because it's always fentanyl, and I don't do fentanyl. And it would, I'm just like not gonna start now because of like, why would I start right now? And there's that factor, and there's also, I mean, yeah, I guess wishful thinking. Like you get some tar, or I guess on the East Coast, maybe you've still got like not tar heroin, like powder heroin. But yeah, hopefully there's no fentanyl in it. I've heard there's some pure tar out there in like San Diego or something, but I don't know if that's true. But that would be, the one way, the lay person that doesn't have a mass spectrometer could try and figure that out. In any case, they're not as cost prohibitive as xylazine test strips. Fentanyl test strips for nonprofits are about 75 cents a strip, and xylazine test strips are like $4 a strip, which is why I try to have people use their xylazine test strips on site and with somebody else. If they like, let's have a testing party if anyone's suspicious, and everyone can test their fentanyl together. And then if someone does have xylazine, well, like, who did you buy it from? And let's go to that dealer, or why don't you use this person's drugs? And I'll give you a $10 incentive to like throw this away. You know what I mean? But it's going to happen here. It's going to happen like it's in New Jersey. It's going to happen like, but the longer we can prevent people from getting these gnarly wounds, and help them with any positive change in their life, the longer we can delay any harm, is what we're doing here. I think so. But yeah, Narcan, naloxone, and rescue breathing. That's really what you need, said testers.
So in the event that someone shows up to your site and uses either fentanyl or xylazine test strip and it comes up positive, what are sort of the next steps in terms of ensuring that person can use safely, and that they're staying engaged with your services?
Godspeed. I'm just kidding.
Right?
God
Yeah.
damn
Well,
it.
yeah.
These days, everything sucks. Everything sucks.
Conversation. Like we have a conversation then, right? We talk about like, for us, like if we're doing our street-based outreach, we know that a lot of our folks don't use by themselves, right? That is a little bit safer. They're like, when, police aren't tearing down their encampments, but, it's one of the reasons we support encampments staying around, because there's some safety there. There's some safety in numbers, like literally when it comes to using. So we talk about that. Like, are you going to go home alone? If you are, like, what's the plan? Or can you like go to a friend's house? Can you make sure, we talk to people about leaving their door unlocked if a friend lives upstairs or lives in the area, things like that, if they're going to be alone. And we really try to limit like scare tactics, because like I said, fentanyl's there, people are using it. And making someone feel bad about what their bag tested for is completely useless and serves absolutely nobody. So really having those like logistical, practical conversations, what's the next steps, happens. That's my tactic for it. And then also talking about like, just asking, what are your safety measures? Like, what do you do to stay safe? What's your go-to, right? Like most people have a buddy system or have a safety system in play already. So we talk about that and what can we do to like add to that, or what can we do to make it a little safer?
And I think with xylazine too, it's a really good time for people to start considering doing more drug user organizing, because at this point, when I say things suck, I'm like, things suck. Like we lost, like fentanyl's non-euphoric, right? Xylazine brings you down. So where you are like in an ambient walrus, everyone's co-using meth. There's no, like people like are using fentanyl with massive anxiety because it has no legs. The second that you're like, you start getting sick, you start getting really sick. And so you have to be such on a hustle. And then with xylazine in these wounds, it's just like, what the actual hell is going on out there? And maybe we need to start organizing together to ask these questions louder and together, because this isn't acceptable. And what are the solutions? Because we don't have many. We have what? MAT, Suboxone, sometimes methadone, which not a lot of people want to get on. And so what else are solutions? Like wound care kits, you know what I mean? Like, so I think it's really time to start like uplifting some voices of people who are suffering with what's happened with the drug supply, and asking why and how we can really resolve this shit. Just going to go right straight to that, because
Yeah,
I'm skipping the fucking conversations with our participants about like, hey, you guys are going to get a lot of wounds. It's like, what do we want to do about this shit? Just,
yeah. Yeah, I would say like for us, like the wounds, it's important to have those like, so let's just make sure people know, right? Like what the wounds are, what they look
for
like.
sure.
But like you said, yeah, like they're, once a couple people are informed, like everybody's informed, right? Like we're drug users, we're really good at like sharing the tea and like getting the word out. And I think like one of our tactics has been like, we know who in the community locally like is like that, kind of like town crier, like the mayor, the unofficial mayor. And when they know, they can let their friends know. And so, that's some of our staff members, some of our members, some of our participants. And my thing is too, like, I always thought this myself when I was like receiving care. I always felt like information was sort of like dumbed down to assume like, well, if you're using heroin, you must be super smart. So we're gonna give you the basics. But I'm a nerd, and like when I get high, I like to like zone out reading stuff. And I know that other people, that I can't be the only one. So my tactic on that is like give information. Like what I want to write down everything I know, and like how do we do that in a way that's not overwhelming? But like, so we like to make a lot of things accessible and let people know, like, hey, if you want us to go to Staples and print you out like all like 80 pages of getting off right so you can like put it in your pocket, like we will. Or we can just like cut some pages out for you, like print specific ones. And so when we started talking about xylazine wound care, I kind of was like, what would we do if there's like a getting off right but for xylazine, and started to write a zine. How do I talk to people about it? How would I want someone to talk to me about it? Right? Like, I want them to be honest. I want to know why it's here. I want to know not how to not use it. I want to know how to like stay safe, because I might be using it anyway.
So my question with xylazine, I think, differs a little bit from fentanyl, because I think even though that the margin of error with fentanyl is so much smaller than it is for heroin, there still is, practices and ways of using really safely. I'm wondering, are there ways to use xylazine that are safe, or is this a matter of just trying to reduce the amount of harm that the wounds cause?
I'd say in my experience, like, I've not used xylazine, but my experience with the folks I work with who do, there's a couple of different things. It, like anything else, it hits everyone differently. Not everybody who uses xylazine gets the wounds from it, because it's got a lot of factors like how your blood flows. So if you have other vasoconstricting factors or like pulmonary, there's different factors. And so we'll see a couple that like they definitely use the same stuff together, and one has really intense wounds and one has nothing. And so that makes it kind of like really confusing, right? But what we do know is that it's not that like it's this flesh-eating thing or all that propaganda, that shit that you're hearing on TV. All that does is just other drug users more and make people feel bad about their choices. So like, stop that. If anyone here is using that language, like, please stop it today, or like make a conscious note to like try to stop it as much as you can, because xylazine is just something that slows down blood flow. And so, yeah, when you get a wound and your blood's not flowing properly, it's going to create an ulcer. It's going to create, a deep, instead of like an abscess, right? We're pretty much, anybody who's like a seasoned, like, dope user, like drug shooter, is like used to what you do with an abscess, right? With xylazine wounds, we have to let people know it's not an abscess, because you do not want to cut that and drain. Like, it's the opposite of care. And so a lot of it is informing people about what to look out for, so that if you can catch it small, like when our folks catch them small, they heal their xylazine wounds. They don't have these arms full and things. And that's not to say like it's all the time, but if you can catch it small, clean it. In New Jersey at our syringe service programs, we have like nurses on site, and I know like we work closely with like some of the med students, and we're trying to get that going more. Like, utilize your medical professionals and like get people used to seeing them when something's small, because my thing is like, don't wait, treat it like a big deal when it's a tiny little, like, people were thinking they were like cigarette burns or spider bites or things like that, trying to figure out what it was, and letting people know that, okay, if it looks like a spider bite, but like there's no way a spider bit you 5 times, like, here's what it might be. And so again, trusting drug users with that education. Like, we have to trust drug users with the education. We can't just hold it as service providers and like wait for them to come to us. It's not how drug users operate. We don't do that. Give us the knowledge, educate people, and like, we can stay safe,
And we have to multiply outreach efforts, like, by, I don't know, I mean, in San Francisco, I can't even imagine how many times we need to multiply what's out there, because there's whole blocks here in the Tenderloin, if y'all know the Tenderloin or know about San Francisco or whatever, where there's just people lined up on the sidewalk, just covered in extremely like painful looking wounds. Like, there's blocks of them. Like, people with wounds actually tend to like to be together. I don't know why. What causes these clusters of folks, but please stop. Sorry, I got into the Narcan person. We have these clusters. God, sorry. But they're not getting the supplies they need, because people aren't doing enough outreach. There's just not enough money hitting the direct services to be helping people in these instances. And back when people were injecting more, because the one miracle about fentanyl, the one that I could think of, is that people slowed down injecting because you can smoke it so easily with the straight shooter and the foil like this. You know, very, very cheap, and also less infections. But people, when they were smoking, when they were injecting heroin more often, we were getting a lot. I would say half of our participants that were dying of drug injury related causes were dying of infection related causes um, during heroin with because overdose was happening a lot. But our participants are old school, they're seasoned, they're career users, and they weren't overdosing. They would wish for an overdose. What does it feel like? You know, never gonna know. But now that you know, now we're gonna see that happening again with xylazine, but with fentanyl, it slowed down for a sec because people weren't having as many open wounds. So yeah. Anyway, outreach.
In terms of your outreach, I think someone might have mentioned in the chat earlier, but around outreach specifically to stimulant users who might not know that they are also going to be using fentanyl in the drugs they're taking. Are there specific strategies that you've taken in your work to work with communities, particularly older drug users who may be feel like they have a handle on things and have been using safely for 20, 30 plus years, but are suddenly being inundated with this unsafe supply? What sort of approaches are you taking to help with populations that might not think that they could benefit from an SSP?
Providing more than just syringes. I think if you're not providing smoking kits, like depending on what's big in your area, right? Like here it's stems, like we provide stems, a couple different types. We provide snorting kits. Having those kits, having those conversations, like that is the number one way to make someone feel welcome if you have the thing that they want, right? Because I always thought of like if I'm not injecting, like when I was like really ripping and running, like if I'm not injecting, I don't need to go to the harm reduction center because like I'm not injecting right now. And so having supplies that welcome all different types of drug use is really important. It's harm reduction so much more than needle exchange. And then having those conversations about, for us, like I always hear like a lot of our folks that are stimulant users are the people that are reversing overdoses, right? Because like they're up, like they're there, they're paying attention. And so I think it's important, it's like not just for education, but like as a community care as a whole, like remembering that there is a lot of like symbiotic relationships among drug users. Not everybody uses the same drug just because they hang out together. So really like make it welcoming for stimulant users and they'll feel welcome.
Bubbles. Give out glass, give out pipes. I mean, come on. I mean, every single person that comes into the union wants pipes. And also the fact that we're community run. I mean, people come in here just to, say hi and feel like there's a place for them. Because, there's people that are from the exact same circumstances that they've known for years, like running the place. And there's no, there ain't no squares here, that's for sure. I'm the squarest person here. That's for damn sure. Sometimes people say I'm not, but I'm definitely the squarest person here. But yeah, I mean, like having a welcoming vibe, letting people use the bathroom, being straight up with them, like preventing circumstances where they're gonna piss you off. Like before people like open their backpack and dump their shit on the floor, be like, don't do that. That's the rule. And then you don't have to like be barking at them to pick up their stuff for the next like 5-10 minutes, and then you get in a fight because like I'm doing my best, and you're like you shouldn't have done it in the first place. Don't let them, like preventative measures to like not have moments where you're gonna bum someone out. It's really helpful. And that's with all things, if you get your phone stolen at needle exchange you work at, that's your damn fault. So plan ahead. But yeah, I think it's anywhere where people feel welcome. The union, I mean, not to like everyone's going to have their needle exchange, or I still call it needle exchange, whatever, that service program that they like more than others or whatever. But I mean, people really love this place. We were closed for about 10 months, and I came here to reopen it because I'd been gone for a while, and I just knew it needed to get back open. And people just like still coming in being like so stoked that it's here because it's a community center,
don't mean to make a really hard turn into logistics, but we did get something in the chat asking where y'all get your testing strips from, and I guess to add to that, where do you get pipes from? Like, how do you get funding for pipes? Those two things I think are things that might be questions that a lot of us have right now.
That's like so regional, you know, like it's so
Yeah.
like state by state, city by
I was
city.
gonna say it's state by state. Raise it like straight up community based fundraisers that don't come from, you know, like the state budgets and stuff like that. That's
All
donations. And like if
Alibaba, dude.
yeah. Yeah. Well, I was gonna say, or
All,
you know, we work with Smokeworks. Smokeworks has really reasonable prices and their ethic, it's like harm reductionists. So we're like paying other harm reductionists for their work. And then they also make grants for like organizations that aren't funded. But yeah, it's like pipes are not expensive, but like because they have so much stigma around them, government funding won't pay for them. It's something we're advocating for constantly because they are a like they are one of the most important overdose prevention tools, not just from like even if someone's not switching, but like I said, just having people who use stimulants carry Narcan or naloxone is huge. And so yeah, a lot of it is like, hey, do you have that like punk band that's gonna throw a show for you and donate some like $50 afterwards? That's what funds, like, you know, for us at least. Yeah, and yeah.
uh, yeah, California has funding for pipes, and we have a state clearinghouse where you can get them, you know, straight shooters, the little, you know, the little crack pipes. They're and everywhere has slang too that's different, so don't, you know, everyone can throw in their slang if they want, but these are cheap. They're cheap. I'm actually making a chandelier out of them right now with Brillo in between. It's really pretty like this, so I'm just gonna a little Brillo and a little this and the chandelier. Anyway, that's gonna be beautiful. And then the bubbles, the bubbles, these guys, you can call them what you will, Pookie, oil burner, whatever, meth pipe. Um, they're a little more expensive, but you can get them off Alibaba. If you can wait like 4 or 5 months for this giant shipment to show up half broken, it's still cheap as shit half broken. You know what I mean? Like, and in LA we had the, you know, you got the downtown, the fashion district, the toy district, whatever, and you also got the smoke shop wholesale discount district. You can get 1,000 of these for $200 cash. You gotta pay cash though, and that's the cheapest I've found. That, you know, but it's still half broken pretty much because they got it from Alibaba. Um, I don't know if AliExpress has the pipe option, and sometimes you got to use like fancy words to find the pipes, like tiny spoons that you can sniff off of are called like snuff spoons or whatever, wedding spoons.
Cosmetic scoops.
Cosmetic scoops, right? Salt spoons. I love the pepper grinder. That's like
Yeah.
obviously like the like fucking.
These little ones are so good. They're the things that people use to put like face masks on at a spa, but they have a little like
Uh-huh.
bit. They're good.
Oh, I've got my tiny spoon here. Hold on. Should have one. These, wait, where are they? Sorry.
Now
This is
it's show
actually,
and tell.
I
no, but
love how this
this is
immediately
important.
got into show and tell. Like,
I buy these. I buy them out of pocket sometimes. They're these tiny little shovels. I get them on Amazon,
Uh-huh.
and people love them because you can load your bubble with it. You know, you can pick your dose easier than getting your hands, like your dirty hands and your drugs. And so you just take a little scoop of your drug and you put it in your bubble. And yeah, and people love these. So it's also an engagement tool. You know what I
yeah,
mean? Because people will come back and come back and come back for these tiny little spoons, and they're cheap.
Yeah, when something's cute and quirky, like why not? It gets people talking about it. That's how I feel about harm reduction supplies. Like make it colorful, make it fun, make it, you know, people laugh at me, but presentation is everything. And if I want someone to be like attracted to that supply, yeah, like I'm gonna hunt for those little cute shovels. Like those are
Oh yeah, I'll send you the link. Yeah, I love someone in this chat said gelato spoons. Like, what kind of drugs are
oh
you
like the
doing? Like a
sampler. I'm picturing an ice cream scoop.
oh, I think it's just like the tiniest ice cream sample ever. It's like I hit one taste bud, man.
And I want to share too for anybody who's like, why are these like people laughing at this stuff? It's like we laugh because of it's such a stressful situation. So if anyone's like, I just always say that too. Like the joy
Yeah,
that we're
whatever.
expressing is like harm reductionists, like we need joy. Drug users, like we live for joy. We live for moments
Yeah.
of joy. So just wanted to say
Ha,
that.
like yeah, half my friends are dead, and I reversed 2 overdoses last week. So whatever. But this
Yep.
is So this is a hammer pipe, just so you know. And this, I'm going to say, because I want to say it out loud, these are cost prohibitive compared to other pipes. If you need to make an alternative to this, what it essentially is a dabber. People were getting these because they were smoking heroin, which people ain't doing so much anymore. This is a dab. It's cheaper, just in case you like have like a budget problem. People are demanding these things. I'm like, I'm not paying more for you to get higher necessarily. You can use the utilitarian shit so I can get, because I got, I don't have a huge budget. But those are the three types of glass pipes that people ask for.
Yeah.
I
Oh,
mean,
and
some
then
people really.
I was gonna say for fentanyl test strips, we started buying them from Dance Safe because again, let's put our money back to other harm reductionists. That's my theory. Is like if there's same reason we buy our intramuscular naloxone through Remedy Alliance, right? Like just anyone that's creating that sort of like, hey, we're gonna put back into the community. If we can use funding for that, like we will, because I don't know, to me, that's just like the best way to use that kind of funding. And know that it's going into like the most ethical source of it. I mean, BTNX makes strips too. They're a little more expensive. They have started doing discounts. That's where we get our xylazine test strips from because DanceSafe has been out. But once DanceSafe started offering test strips, we just like scrapped our BTNX stuff and started ordering from them because they're great. They get here super quick. They offer little micro scoops, really detailed instructions, and they're really easy to work with.
BTNX, and just to say this, I know we're like going on tangents, but I was like at my desk when I had an office and I'd had time to observe these things. They had reversed on their instructions the positive and the invalid, and I flipped out. And ACDC was having like a drug checking conference, and like because someone kept calling me and like I keep getting these invalids, I'm like, well, just assume it's because you're not getting two lines, assume it's a positive. And I looked at the test strips and I looked at all their other instructions. I'm like, they have this shit backwards. I call BTNX. The guy's like, well, whatever, NO, like two lines, NO, no. And I'm like, yeah, but you can't have the invalid and the positive mixed up on your package that people are receiving because I keep getting these calls from someone that says they're getting invalids. So yeah, you do want to go with companies that actually do care about like what the like test results say on their instructions more than I got from that person that day. I was like, this is so unnerving. I just think there's like genocide against drug users and everyone just needs to like hug each other and be kind and whatever. Yeah. Look, I always go there.
So the title of this webinar is Safe for Use in the Time of Fentanyl and Xylazine. And I know, Shannon, you kind of alluded to the ways in which the drug supply has just so drastically changed and made simply maintaining a drug habit and avoiding overdose and avoiding withdrawal so incredibly time consuming and exhausting. I'm wondering, like, what can we as harm reductionists, as people who use drugs or people in recovery, like what can we do to make this a more, not, I don't know if loving environment is the right term, but like how can we honor our mental health as folks that are providing care, folks that are getting care? Like you said, like things are shitty, like things are bad in a lot of ways right now. Like how can we be there for one another in ways that are sustainable for both our workforce and for the folks that use our services?
Well, boy, do I have a dream to open like a retreat that's like retirement home for OGs and like a retreat spot for people in this line of work that need to go weed whack for a while with some OGs telling them it's always going to be this way, but at least you get paid. You know what I mean? Like we at least get paid. I don't know. There's not a lot of support. There's not enough. I got on disability for PTSD once, and that was like the best thing that could have happened to me. And I weed whacked a lot. That's why I say weed whacking. Because I'm in this line of work as a peer. I'm I don't I have a job. I never wanted a job. I have a job because my friends are dead or they're not doing well and my communities are decimated. And so what gives me any working with the population that is affected by drug use the most impacted, working directly with them is what keeps me in this work because gives me the opportunity to have a positive impact in somebody's life, and therefore it's it's refreshing. But what we can do as harm reductionists for each other, I mean, I honestly don't know, because I'm a little bit skeptical about professionalism and relying. I think actually not thinking about harm reduction as your community, but thinking about it as your job, doing your job, and then having friends, keeping it like to a certain extent, because there is a movement here. But I've watched time and time again, people feel like they've once they don't work somewhere anymore, they don't have harm reduction community anymore. Like these people, like no one calls, no one checks in, and that goes for, I mean, Edith Springer's alive, and not just so I can say a name out there or some shit, but like there's a lot of OGs out there that like are forgotten. And so I would say stick with your homies and don't let this work become your life, for real. Because it happened to me and
I
it's horrible.
agree. No, I agree. It's like, because then you burn out, like work becomes your, and it's hard when it's like, oh, but I like to know about drug user health and all that stuff. That is my like interest area, but it's what I'm doing for a living. And I agree,
Yeah.
like having some boundaries where, for me, it's like on Sundays, like I do my own harm reduction, but I don't do harm reduction for anybody else. Like I have certain days where I'm like, there's a small list of people that can get through my like do not disturb, on my phone, and that's about it. And that's just like setting a boundary. But like it's hard because then there is like the emergency stuff and there is showing up, and like the burnout rate, because we have the people closest to the harm doing the most traumatic work, and it can be re-traumatizing. And so like, I was talking about this yesterday. It's one of the things we're working with at NJHRC. We're fortunate that we started from scratch, so we can sort of like bake in what we want, or at least try to. Having employee assistance programs, having health insurance, having a living wage, like things like that are hard in institutions that have been existing forever or can't get funding, but fighting for that. And if we all are saying that, like we all need to say that. If you make $60,000 a year, but your like frontline workers make $30,000 a year, you shouldn't be okay with that. Like you should make more and they should make more. And like, I think, that's like some advice that like Jenna, shout out to Jenna, a co-founder of NJHRC, our executive director. Jenna and I got really great advice from a friend and someone with more experience than us in the harm reduction world when we were starting out. And they were just like, start your salaries high and just fight for that funding. And so it's slow, intentional work while we're working at a pace that is so urgent, but like finding that balance is important, because right now half of our staff is out with like either family emergencies or like personal like wellness emergencies, and we're able to like make that happen for them, right? And like if not, like if we're just recreating like capitalist like come to work sick and take your Dayquil, like I tried to come to work on Dayquil last week and I was like looped out of my mind. It wasn't a good idea. So
try ketamine.
it was similar, right? But
no, yeah, it would be. It sounds like it would be.
But yeah, so like I think just that like trying to undo structures like harm reductionists, like community care is important. And just what Shannon said, like make your friends, keep your friends close, hang out outside of work and don't talk about work. Like
I don't even know how to not I don't even know how to not talk about work anymore, and it's horrific for me. Like I can't escape it because I got so immersed in it. But to that too, I asked, like, because when I came back to SFUU, I really wanted, when I hired all the staff, to design policies and procedures that would be trauma informed for real, including trauma informed pay whenever we have the funding to do it, which to me in San Francisco would be frontline staff getting $60,000 a year at the minimum, because then you can get a studio apartment, you don't have to commit crimes to, do your hustle, blah, blah, blah. I mean, depending on, your size of your habit or whatever, but like nothing is more trauma informed than paying people well, because then they can choose what they're doing with the fucking money. And that's it. I mean, that I think, and then you can design all the policies. You need gender violence-based policies. You need like triggered by the news for like anything, like policies like that let people take a break. Because there's trauma can surface everywhere, and just having enough staff, having programming design that's not so like, you know, quantity based or measured, you know, by what funders want, but actually having it be like healthy workplace means healthy community for sure. And so I think that individual organizations can definitely support each other. And I think that we could network together to support each other better if we came up with some standards as a, you know, as a broad movement for how we should be treating our workers, especially frontline staff.
Wonderful answers around. I have a question from the chat asking, I got someone from Modesto, California, saying they have new SSP up and wondering if you could talk a little bit about how local law enforcement handles safe smoking supplies and test strips, specifically if more warrants are issued, if there's more harassment of participants, and wondering how to protect the participants from harm by law enforcement as they start increasing distribution of pipes and needles and test strips.
I mean, cops suck. They're always going to harass people. One of the reasons we do policy advocacy too. So like we fought really hard in New Jersey to decriminalize syringes, even if there's like residue or drugs inside of them. That was a fight, and like we're, you know, even like New Jersey, I always say is like blue on paper, but like red in practice. And so we fought really hard for that. Drew, you were part of that, so you remember. So like we got fentanyl test strips and syringes decriminalized. And then, you know, we are going to be fighting really hard to have other things decriminalized. If you can get it at a harm reduction center, you should not be arrested if you don't have your harm reduction center card with you that day. But like in New Jersey, you have to have a little card that says you're a participant. Although I've had mine like looked at and tossed over the shoulder by a cop and told like, go fuck yourself. I don't know what this is, but that was a long time ago, before people knew that syringes were a public health thing. But yeah. So basically there, for us, sorry, Shannon, for us, it's,
okay.
We partner with Rutgers Law Program through Vital Strategies. They have a partnership with Rutgers Law, and they do some pro bono work for our clients if they have a drug related charge. So that's kind of where we're starting, because we have not seen where friendly relationships, because even with decriminalized syringes, they're still arresting people for them and then just like, oh, we'll throw the case out later. So like they're using them as like a reason to search for more. And so unfortunately, unless like something major happens where law enforcement stop harassing drug users for an easy arrest, I don't see much insight other than kind of surpassing that and working on the legal side of things, making some legal partnerships with radical lawyers.
There's I would just recommend there's a oral history of Massachusetts harm reduction that has been made, and it's amazing. People that really just started this movement that have been, you know, it's got Eliza Wheeler, Gary Langis, Joy Rutger, Hollis Bradford, Mary Wheeler. I mean, all these people that have really been doing this since the beginning, and that might also give you some ideas, because they're very creative. And when this shit was, you know, even harder to do under the law.
Okay, so we've got a little over 5 minutes left in the webinar. Wanted to just sort of open up the floor, Caitlyn and Shannon, for any final comments you might have. Rest in peace, Jerry. About anything related to your programs, xylazine and fentanyl use, or anything in the harm reduction orbit that you want to talk about.
I guess the thing that's on my mind a lot is, since we're talking to what seems like a lot of service providers, from what the chat says, really, again, just like when it comes to xylazine wound care, do not wait for someone to approach you, because there's so much shame. Like, you know, there were years where like I just didn't wear short sleeves because like I was really ashamed of what my arms looked like, right? And that is real. There's so much stigma and shame just from a track mark. So then like add on to that like a really gnarly wound that looks like something you never want on your body. Like talking about it's hard. So like start out with the education, like get those folks work, like Shannon said, outreach, find those folks who know everybody, find like the neighborhood nurse, find like the block doctor, like find those people Get them educated. Ask what they want to learn. Get them as informed as you are. Don't think that the knowledge has to live with you. If you're a nurse and somebody's asking you a bunch of questions, share that with them. I learned this wound care protocol from an amazing wound care nurse that I don't even know their name, but they're from Blue Mountain Heart to Heart. So shout out to you if you're there, from an AIDS United like webinar that we were on together. And then I've just like checked it with an actual wound care nurse and was like, oh, this is the right protocol. Cool. We'll teach this to folks. And like, when I talk about information, so like, this is our wound care kit. Get some high quality supplies. Invest in Zeroform. Invest in Zeroform. Don't put Meta Honey on people who sleep outside, please, because it'll attract bugs. And like, we put a lot of information, right? Not everyone's going to read it. So the important stuff is circled and bolded. But some people are going to read it and they're going to remember it and they're going to tell their friends about it. So trust drug users with information and supplies, basically, is what I would like to convey to people.
And I'll follow that with trust drug users in City Hall. We need to start organizing people more. We need to re-legitimize harm reduction by letting the people who started it, the drug users, take the wheel for real. I can't stand provider meetings anymore. I can't stand them because I work only with people who use drugs, who are having urgent emergency situations and needs aren't being met, and us talking together without them in the room. Like, when I bring people who use drugs or unhoused to meetings, even like harm reduction spaces, you can see people kind of like, adjust. They got to like rethink how they're going to talk. Like, they got to think, and we need that in every place where they're making legislation about people who use drugs. They need to see that presence there, and they need to reconsider their words based on the fact that the people they're talking about are in the room, which they never are. And that is why people are dying, being put into conservatorships, not knowing about class action lawsuits like Suboxone, where they can get their freaking teeth replaced possibly. Like, they need to be included in all the conversations that we're having with each other, our meetings, where we're learning about this stuff and not properly disseminating that information to the population who needs it most. We need to organize a lot more, because when I say that this is a genocidal situation, like, tell me I'm wrong, like, 2 of our oldest participants would have been dead in the last 2 weeks had I not been present. And they're dropping like flies, and there's no time like the present to meet a fucking crisis where it's at and fight back. So Zeroform, fuck yeah, we just got for the first time. The street med was like, that's the shit, and I was like, good to know. And then I put Meta Honey in little baggies, like little.
Meta Honey's cool. It's just, I always think like people forget that if you sleep outside, bugs like honey. So like,
I think it also will like start, if you leave it on too long, it might start affecting your skin,
Yeah, it's great though.
But I know the Zeroform is safe, and people like it. So hell yeah, it's not exactly cheap, but I think you can get it cheap if you partner with some doctors. Get it for you.
Nason Buyers Club. Pretty good. Pretty good for Zeroform, honestly.
Hell yeah.
Well, thank you so much, Caitlyn and Shannon, for sharing all this amazing information with folks. Thanks to everyone who has attended. I'm going to throw it back to Annie and Angel to see if they have anything in terms of follow-up information. But it's been a wonderful discussion. Thank you.
Yeah, thank you all so much. I am going to put in the chat the email you can reach out to if you have any questions, if things didn't get answered, or you want to like be put in contact with any of our speakers today. And it's pretty easy, harmreduction@aidsunited.org. And we can respond to any questions that maybe you didn't have, or help you with any connections that you might be seeking. Thank you all for joining us today. I hope you got something valuable out of it. And thank you, Shannon, Caitlyn, and Drew.
And also, if anyone that's here has a harm reduction related policy issue that they would like help with at the state and local level, give me a holler. Happy to do what I can with my colleague Frida. So yeah.
And that's not just talk. That's actually true. Drew showed up so hardcore for New Jersey.
And I loved the chat. I feel like the chat was really cool. I feel like we had a lot of cool people here today. So that was exciting. I wasn't like annoyed once. And I get so annoyed. All right, thank you guys so much. It's been really fun to hang out with you all.
Absolutely. Bye all.
Bye.